Hi everyone, Dean here from Oceania. I just wanted to chat to everyone today about an interesting topic that came up on Inside on SBS the other night. I'll just get it up on screen. I don't know if any of you saw it, but it was a show about how effective is surgery for hip, knee and back complaints. And it was great to actually have this topic debated because the last few years we've had an explosion of people getting hip and knee and back surgery. One of the reasons for that is we're living a little bit older and people are seeking these procedures. But the great thing about the show was that they're actually challenging the situation and trying to say, well, is it actually an effective way of treating these sort of conditions? And essentially what they said, and it was really a couple of a professor on there from I think University of New South Wales, he basically said, well, if they do a controlled trial and do a placebo in there with placebo surgery, which basically means they get people, tell them they've had surgery, and then treat them in exactly the same way with a little bit of rehab after and whatever, and they found that the outcome is exactly the same. So when you hear stories like that, it's like, well, what's going on? I mean, how does that happen? Well, I mean, the mind's pretty powerful and it can help contribute to you feeling a little bit better and being a bit more confident. But the thing about it is that it just sort of ties into what I've been saying for a few years in relation to how the medical system works, is that because everything is channeled towards traditional medical treatment, everyone goes down that path. I mean, another example is that there's that many people out there getting scans now, and the scan might show pathology, but the pathology that they find might not be the cause of the problem. And the other thing is you might do a scan and show no pathology or damage, in part of the muscles or the joints, and basically, they're basing it all on that. But the real issue that came out of all of this is that surgery is not the only option. Teaching people how to exercise safely, losing weight in a lot of situations. I mean, obviously, if you're overweight and obese, that's going to place a lot of strain on your hip and your knees and your back. And really, I mean, the emerging trend of saying that, look, hey, your hip and your knee doesn't work in isolation. I mean, if you've got a sore back, it could be related to a few different issues, and that's one of the problems with medicine as well, that we clump everything up into an expert on your brain and on your head and your hip and your knee and your joints and your, heart and whatever. I mean, and yet we're not looking at the whole body and trying to deal with those sort of things. And that's an issue that we need to deal with. And the thing about it is, I mean, it basically said that we just need to do things a little bit better, and actually give people the opportunity to get treatment and work with someone who actually knows what they're doing in relation to how to exercise safely, how to progress the exercise to get to the point where you increase the strength around the muscle, improve the flexibility, look at how you move and your walking gait, and give you some coaching on how to do that a little bit better. And essentially that's really what they're saying is the way to go with this sort of stuff. But unfortunately our medical system and our government haven't caught up with that and actually funded and resourced the sort of stuff that we need people to do. And yet we're sending everyone off to go to the surgeon to fix these problems, which essentially don't need surgical intervention. I mean, I'm sure there's situations where it is necessary, but in a lot of cases people can get treatment. And the thing is, over the years things have changed a lot. I mean, back when a few years ago when I first started working in the rehab area back in 1993, I mean, the thing was, I mean, things really haven't changed that much, unfortunately, because it's all about the medical treatment. And the thing is, we have two different systems of rehab out there. I mean, you see what athletes do when they get an injury. They're straight into the hydro pool, they keep working, they keep fit, and they work around the injured part, keep the body fit, and then get someone to coach them through and strengthen them up so that they can do things. Whereas the average person, I mean, all we really do is tell them to sit down, rest, take it easy. And yet, why do we have two different systems of rehab? I mean, it just doesn't make sense. So I suppose, what we all need to do as a community, and hopefully some of you who see this video might, start to challenge your doctor and say, well, hang on, why do I need surgery? What are the alternatives? Who else can help me with this condition? I mean, who are the people out there that are appropriately trained? Now, I mean, we deal with this sort of stuff day to day with our members at Oceania, but at Oceania here we've also got a Optimum Health Solutions Tasmania, which is an exercise physiology clinic. And we've got a couple of exercise physiologists on staff, Sam and Josh, and they do this sort of stuff on a daily basis. We're working with a lot of clients to help them improve their leg strength, their balance, their coordination, and to deal with all these sorts of conditions. And if you take the time to look on Inside on SBS and have a good look at the show, you'll see that a lot of the people, who were in the show said that they got far better outcomes from working with a trainer and with an exercise physiologist to actually get the results that they're after. So, and we've changed a lot of what we do at Oceania over the last few years as well with how we train people, and it's really about the functional capacity to do the things of daily life. You know, how you sit, how you stand, how you move, you know, how you're walking. You know, it's not about standing in front of the mirror and pumping weights and building up your biceps. You know, that sort of era is long gone, certainly at Oceania anyway. And it's all about, you know, looking at the individual, finding out what the issues are that you need help with, and then actually designing a program around those things to actually get you back to where you need to be. So, you know, and the other thing that came out in the show, which was really interesting as well, was that all these people were talking, you know, some people had 8 and 9, and I think one guy said he had 11 surgeries on his knees. And he went back and saw a physio or an exercise physiologist, and essentially he now is able to, he walked, I think it was Mount Kilimanjaro a couple of months ago, and before he couldn't even do that sort of stuff. So, you know, if you work with the right person, hang on, just finishing on the cost of it there, I mean, he said he was tens of thousands of dollars out of pocket. And I mean, even if you have got private health insurance or if you're on the public, nothing's for free, you know. And I mean, investing a little bit in getting some correct treatment from the people who know what they're doing is really the way that we should be encouraging people to go. And it's certainly what I believe is what we do here at Oceania, and why we focus more on you know, expert coaching, you know, supervision, showing you what to do. I mean, if it was that easy to do it on your own, I think everyone would be. And you know, we just want to let people know that, you know, that's certainly what we're about here. But anyway, hopefully that's something for a bit of food for thought for everyone out there. You know, I mean, getting, you know, in every other area of life. You know, when you get legal advice, you see a lawyer. When you want tax advice, you see a you know, an accountant. Well, I mean, I think we need to accept that, you know, if we want people to get healthy and fit and know what they're doing, they need to see someone who's appropriately trained. And our exercise physiologists who work here at Oceania, who are basically, you know, university, tertiary trained fitness trainers that have got, you know, a little bit more training and expertise in rehab and the progression of exercise. And certainly my team of trainers here are not far behind that with the guys that work with our members as part of Oceania. But anyway, like I said, a bit of food for thought, and I hope that gets a few of you thinking. You know, it's not always about surgery, and you know, getting the right advice can be you know, make a huge difference to your quality of life. So give us a call. You know, if you read this and you've got any comments, you know, comment below and ask some questions. I'm here to answer your questions and you know, help you in the right direction. But you know, with the facilities we've got here at Oceania, with the hydrotherapy pool and the main pool, and the way that we do our structured strength programs, I'm sure that we've got something that would suit everyone. But thanks for listening, and bye for now, and see you next time.